Thank you, Scott. I'm happy to follow that with the Counterpoint. Since 2002, I agree, when we worked on this report, that the landscape has totally changed in terms of our interest in antimicrobial stewardship, but then resistance has also increased. I think of those 4 major recommendations that you mentioned, including veterinary prescription only, they're actually still not in place. I think they'll be in place December 2017, or maybe it's March 2018 and so on. They're still not there. I think, as Alison said, the Pan-Canadian Framework for Action is behind schedule. It was published last week. And the Pan-Canadian Action Plan has still to be written. Having been involved in one of the team task forces putting information towards the development of the framework, I know what a horrible and ugly and chaotic and frantic process it is. I can't imagine how that will get changed into an action plan where it becomes much more complicated to actually get down to the details. So at the moment, I don't believe we have effective stewardship in the animal health sector. We've got no map, there's no plan, there's no timing, there's no checklist, there's no effective leadership or coordination structure. When you think about the different groups involved in stewardship in Canada, it's actually complex. We've got the different federal agencies. I still believe there are jurisdictional silo issues there. The provinces are involved, as you described. I'm not sure that all the provinces are on board with the changes in the regulations and the distribution of antibiotics to farmers. The Canadian Veterinary Registrar is obviously involved with the registration of veterinarians. But some of these changes have to involve changes to the Animal Health Acts. CVMA has done a stellar job, I agree, but they're a non-regulatory group, and Canadian Animal Health Institute's been great. The different farm groups, I think there's different levels of engagement. I don't believe that all of them are actually convinced about the importance of making these changes. They don't see the antibiotic resistance as an agricultural problem, and I think the various veterinary groups are just kind of watching to see what happens. So to me, a major factor preventing the timely development of a pan-Canadian stewardship is the lack of an agreed leadership or coordination structure. And I think that has to involve resource allocation, reporting, measurement, evidence, and the ability to intervene, and we don't have that. I've got lots of questions about stewardship. I've got lots of questions about who has the overall responsibility for developing, monitoring, evaluating, and communicating the action plan. What's the various roles of different federal agencies? How are they going to interact with the ministries of agriculture and the veterinary regulatory authorities? How are the veterinary regulations going to be harmonized across the country? There's a lot of work involved in doing that, and the provinces control this, not the feds. What's the roadmap? What's the guidelines? What are the metrics of success? How will we know we've been successful? We have no idea at the moment. I think if you can't measure it, you can't manage it. We can't measure use at the moment. We got data, but we don't know how valuable they are. We don't have them down to the veterinarian level. We don't have them down to the farm level. How are we going to manage things if we don't know that? I think considerable reduction is possible. This is Holland. It's achieved a 65% reduction in antimicrobial use in animals in the last 7 years. And along with that is the reduction in resistance in the indicator bacteria that Rebecca Irwin and CPAS are measuring. But look, Canada is here, it's probably above here, and we're still flat-lined. This is what Holland has done, but we're still sort of bombing along somewhere around there. When we talk about stewardship to practitioners, we talk about the multiple elements of it, the importance of practice guidelines. There's no practice in the country that has veterinary practice that has written guidelines on antibiotic use. We talk about infection control, biosecurity, clinical microbiology, surveillance, which is critical, particularly use surveillance, using drugs the way they're supposed to be used, depending on the particular type of antibiotic we're talking about. we talk about the really importance of leadership and stewardship, and we talk about education and owner compliance. And I just focus on leadership. That stewardship programs, the number one thing people say about stewardship, you must have leadership. You must have buy-in from the leaders in the process. So in terms of good stewardship practice, I really believe it needs effective leadership and a coordination structure. Maybe that will come out in the action plan, but I go along with the Auditor General. I think, in my opinion, the development of a pan-Canadian strategy for stewardship is going to take many years. So thank you.